Hello, everyone, and good afternoon. My name is Chidima, and I'm your host for this session. Our next session is a talk that is titled Identifying Biomarkers of Cardiovascular Diseases with Machine Learning, and it will be delivered by Vasileios Nikolaou. Vasileios is a statistician with more than 20 years of experience in academia and industry. He has published more than 50 articles in peer-reviewed journals on studies that cover a wide range of therapeutic areas, from mental health to oncology and cardiovascular diseases. His research interests are medical statistics, machine learning, and deep learning. And for the last 10 years, he has been working in the pharmaceutical industry. Please join me, welcome Vasileios.
Thank you for the introduction. Yes, this study is part of my PhD, and it's called, I will show you how to identify biomarkers to predict cardiovascular disease and use machine learning. And it's also publicly available in medical research archives. So before I go into the presentation, I'm going to give you some context about what are cardiovascular diseases, what are the risk factors, and the role of biomarkers in predicting cardiovascular diseases. Then I'm going to give you some literature review, what are the existing studies on this topic, and how my study is different from the existing ones. Then I'm going to go deep into my study, and I'm going to introduce to the study design and the objectives. I will give you some key results, and I will finish with some key takeaway conclusions. So what are CVDs, or cardiovascular diseases? As you probably know, it's a group of conditions that affect the heart, but also have an impact on kidney, liver, lung, and other organs of the body. And they occur when fatty tissues accumulate in the arteries. And when they do that, the arteries get narrow, and they create clots. And then clots they cause heart attacks and strokes. And according to WHO, CVDs kill about 18 million people every year. And 85% of those deaths are due to heart attack and stroke. So it goes without saying that the burden of these cardiovascular diseases is very big, not only to the people's well-being, but also to the national healthcare system due to increased costs. So the public health providers, apart from promoting exercise and a healthy diet, they carry out surveys and they collect the information on risk factors such as smoking, drinking, alcohol consumption, dietary habits, etc. Along with those risk factors, there are also biomarkers, which are small molecules in the blood that they are connected to any disease. And these biomarkers are related, like cholesterol levels, triglycerides, hemoglobin, etc. They are also have found to be related with cardiovascular diseases, but they are not directly linked with risk factors in the same kind of survey or database. So the aim of my study is to integrate both biomarkers and risk factors to better understand CVDs and be able to predict it early. And early diagnosis means better treatment. And better treatment can save life and reduce healthcare costs. So here you can see some literature, some studies, the most prominent studies that they have carried out, and they date back to more than 10 years ago. And the common characteristics of these studies is that they are quite large studies. They range from 1,000 participants to more than 16,000 participants without CVD at the baseline, so healthy individuals. And they do integrate biomarkers and risk factors to predict health outcome, CVD outcome from 3 years to maybe even 16 years after the follow-up. But what they do is that all these studies, they use traditional statistics to predict that. They use survival models. The big disadvantage, however, of these models is that they make the assumption that the hazard risk of CVD is constant over time, which is quite an unrealistic assumption. So in my study, I use machine learning to predict the outcome, the CVD outcome. And machine learning, as you know, they don't do any such assumption, and also they allow for nonlinear association between the predictors. The study that I'm talking about is part of the UK household survey, which is called the Studying Society. It runs since 2010 until now. It's in 2010-12, it's the baseline where adults 16 years and over, they take health assessments where they provide the lifestyle characteristics as well as the biomarkers through routine blood tests. And another also difference in this study compared to the existing ones is that the definition of cardiovascular diseases is more broad, while other studies they have used only one congestive heart failure or coronary heart disease to predict. The participants in this survey, they have reported having any of these events, like congestive heart failure or angina, heart attack, or stroke. So it is more broad definition of CVDs, which means that you can cover, you can explain more type of cardiovascular disease, not just one. So here you can see, for example, the flowchart of this study, and we start with about 36,000 participants that initially are eligible for take a health assessment, but after various inclusion and exclusion criteria, we end up with around 13,000, just over 30,000 participants that they have at least one biomarker. Then we exclude those about 5,000, they have no data, CVD-related data. They do not have any CVD disease. And then we end up with around 8,000 participants in 2021. And only 164 of them, they reported having CVD. They developed CVD 10 years later. And here is the methods that I used to analyze the data. So during the data processing stage, I imputed missing values using the commonly used method of multivariate equation of chained equations in R. Then because I standardized continuous predictors to be on the same scale and hot encoded the categorical variables. So I ended up with 29 predictors that were used to train several machine learning models, from the very basic, the logistic regression, to more complex, which are the random forest, gradient boosting machine, and the Gaussian naïve Bayes algorithm. Then the sample was split randomly into 80% training data set and 20% test data set. And during this process, I stratified the sample by CVD status to make sure that I have the same proportion of CVD cases in both training and test data sets. And also due to severe unbalance, so we had only 2% of CVD cases, we used a resampling method known as synthetic minority resampling to artificially increase the number of CVD cases, and this was done only in the training data set. The test data set was untouched. And finally, we used SAP analysis to visually interpret the predictors of the chosen algorithm. And here I can show you some results. First, I will show you some baseline demographic characteristics for patients that participants who did develop CVD and those who did not. And as you can see, those who developed CVD, they were older, they were slightly overweight. Most of them, they were males. They had a slightly higher waist to height ratio, and most of them, they were smokers. Then, similarly, I can show you some key biomarkers for those participants with and without CVD. So those who developed CVD, they had slightly higher triglycerides, gamma GT, systolic blood pressure. They taken more medication, like beta blockers and lipid lower medication to keep their cholesterol levels low. And then these are the results from the model performance on the test dataset. I ended up with the Gaussian naïve bias model and compared it against with the logistic regression. And from a first view, you can see that the performance overall looks similar because the F1 scores are very close. However, the recall of the Gaussian model, the naïve bias model, goes much higher than the logistic regression, goes 82% versus 48%. That means that this algorithm is more sensitive to pick up new CVD cases than the logistic regression. And then I used some sub-analysis to explain the results, because otherwise it will be like a black box model. So sub-analysis helps to explain, to interpret the predictors. And as you can see from this figure, on the vertical axis, we have all the predictors on the order of importance, from the most important to the least important. And the horizontal line is the sub-value, which is the higher the value, the more important the predictor is. So age, waist to height ratio, insulin, high density lipoprotein, all these are the most important predictors for this algorithm. Then the same predictors, you can see it in another figure, where here not only shows the most important predictors, but also the association with the outcome. For example, the positive, then the negative values, the sub-values, show a low probability of developing CVD, and the positive value is a high probability of developing CVD. And the color, the red color, is a high value for the parameter. The blue is the low value for the parameter. For example, the age, the red color for age, means that participants, the older participants, they are more likely to develop CVD than younger. Similar, participants with a higher waist to height ratio are more likely to develop CVD than those with low ratio, and the same with BMI, urea, creatinine, hemoglobin, and etc. So basically, what we found in this, with this, the takeaway conclusions is that we can do machine learning model to get better prediction than the traditional logistic regression model of CVD cases, and to do as well as, and even slightly better than the existing survival models, without relying on these unrealistic assumptions that the traditional statistical models do. And the implications for the future is that not only we can integrate data from different sources, like biomarkers and risk factors, but also we can incorporate data from wearable devices like smartwatches to get other measures like heartbeat or oxygen saturation, and even enhance the performance of the model. So this will help the healthcare practitioners to provide better tailored plans, treatment plans, depending on the lifestyle of the high-risk individual, as well as the blood biomarkers taken from routine blood tests. Before I close, I'm going to say that I co-edit a special issue on artificial intelligence and precision medicine for the Life journal, which is an open access journal. It's it has highly visibility, and it has a fast track review process. And I encourage you, if you have any research, you can submit it to that journal. Thank you very much for your time.
Thank you, Vasileios, for a very informative session. We have time for a couple of questions. Do you mind? Okay. There's someone.
Thanks for your presentation. I think I understood very well the research and the processes. I think what I'm more interested in is, have you ever considered commercialization in terms of how this can be commercialized in HCP settings?
Yeah, I have thought the commercialization, but I think these algorithms are not the specific one, but maybe even better algorithms have been incorporated in platforms like with Google and DeepMind. They have provided a lot of predictions with using a much bigger databases and more data. For example, I know that there are such algorithms that not only take biomarkers and risk factors, but also genetic information to give you better prediction for any disease. But just this was, as I scratched the surface here, that it's a small contribution or presentation of what machine learning can do better than the traditional statistical approaches. But yes, I think they are already commercialized, similar algorithms.
Hi, thanks for that talk. Yeah, I was kind of curious about your choice of longitudinal data set. So you talk about, obviously this is a huge area, and I guess like with understanding society, I wondered whether there were possibly social biomarkers that you could use that wouldn't be available because you have the UK Biobank, right, which is 500,000 people. So for just biological biomarkers, maybe that sort of data set would be good. But I wondered whether or not in understanding society, I think it's a social survey, right?
Yes.
Whether you could include information, I don't know whether it has things like families or households, and maybe those sorts of things would really be novel.
Exactly. Yeah, thanks for the question. Actually, they do collect that kind of information, like quality of life. They measure quality of life, and but I think that part of data it's more related with mental health, well-being, not so much with physical. That's why I didn't include those measures, but it would be a good idea to integrate those as well to see how it improves the predictability. Yeah, thank you.
Thank you, Vasileios. I appreciate there are more questions, but we are time conscious right now. Vasileios will be here for the networking session happening from 5 to 6 p.m. So please hang around till then, or you can meet him outside to ask more questions. Thank you.
Thank you.